in 3 Americans will be diagnosed with cancer during their lifetimes, and the number of cases is forecast to rise dramatically. That makes access to state-of-the-art cancer care a critical imperative, as we're seeing with the Inova Health System in Northern Virginia. I'm Ryan Langdale. I'm the principal with Chartis Oncology Solutions, and I'm joined today by Susan Carroll, president of Inova Fair Oaks Hospital, senior vice president of Inova Health System, and administrator of Inova's clinical platforms. Thanks for joining us, Susan.
Thank you for having me.
We'll jump right in, and I think a good place to start would be talking about the new flagship cancer center that you have as part of the Inova Shar Cancer Institute. It's a fairly new addition to the portfolio, opening in 2019, and interested if you could speak a bit about the facility and the programs and how they're changing how cancer care is being delivered in Northern Virginia.
Thank you, Ryan. Yes, we're really proud of our facility. It was a long time in the making, probably a 7-year planning process. It's a beautiful facility that we have. And our goal always when we were building that facility was, what could we do to make it different than other cancer centers? We learned a lot by traveling to other cancer centers across the country, but our key goals were we wanted it to be very patient and family focused, and we wanted our patients to know that they could get care in one location. And when we say care, we don't necessarily just mean their treatment. We have a spa in there, we offer classes, we offer fitness classes. We have a beautiful gift shop there. We have a wonderful cafeteria that provides very holistic organic food as well. We wanted to really build an experience that every time a patient goes to our cancer center, that they felt comfortable not just getting their care there, but seeking any types of treatments that they would need in caring for a cancer patient or their family members.
Thanks, Susan. And you alluded to this in the first part of that comment, but the building is new, but the journey has been a multi-year process that you all have executed against. So I wonder if you could rewind a bit and talk a little bit around how the leadership at Inova decided that cancer should be a priority and what some of the goals were in the original planning and strategy.
Well, I think it goes back to your original statement around 1 in 3 people who will be diagnosed. We started this initiative back in 2010 when we were really understanding the community, our role in the community, and really disease prevalence in our community. Inova as a health system over 25 years has invested a lot in cardiovascular care. That was the prevalent disease here within the community. Right around the time of 2010, when we started to really dive into our outreach programs and what we were doing, we realized, based on our age and demographics of the community that we were living in, the population growth that we were continuing to see and the aging of the population here in Northern Virginia, we knew that cancer was going to become our biggest target area that we had to really focus on. And all of that has come to be true. We have a lot of community members here who in Northern Virginia retire in place. So we're seeing an aging of our community. We're also seeing an influx of people into the community still, fast-growing counties as well. And we wanted to make sure that we were keeping up as a nonprofit community health system with providing the best care to our community where they needed it the most. And we knew the next big wave that we had to invest in was cancer treatment.
Yeah, that makes sense. And as you can imagine, we have a lot of other cancer programs we work with that are a few years behind you or in the process of coming to that same realization that they need to make those investments. Any lessons learned in the years that it kind of took to build the center that you would share?
Well, a couple of things. I think my personal lessons learned, and there's a lot, but being a hospital administrator as a background, I always thought of hospital occurrences. We think of terms of surgery, we think in terms of hospital admissions, and you really have to refocus the way that you think of cancer care. It's not the same as other disease sites. And so when you think through cancer treatment and you think about building a cancer center, you have to kind of shift your mindset that you are building an ambulatory center, that most of the care that you're going to be delivering in that facility is going to be ambulatory based. And it gives you a great opportunity to build it in a way that's much better than we would build a hospital, much more engaging, being able to think through that patients are going to be coming with family members. They're going to be here for the day, but going home. And how do you make it a place where Getting cancer treatment is very scary, but how do you make it a place where people can feel comfortable at home to get their treatment? And most importantly, and this was something that I was very passionate about personally, when my mom went through cancer treatment, the one thing that we really struggled with was the logistics. We struggled with her breast surgeon was in one location, her medical oncologist was in another location, her plastic surgeon was in another location. All the different providers that she needed to talk with were spread out all over the county, and just getting to appointments was so difficult. Pulling all of our providers together under one roof and centering it truly around the patient. So having multidisciplinary care meetings, having the patient be able to see 4 different providers in one day during one appointment and scheduling it out has really made such a difference. And it's better, it's not only better for patients logistically, it's really better for their care plan, because the care coordination is so much better when physicians are working together in person.
Yeah. And in that model, Susan, you've got this really valuable resource in this very large tertiary quaternary cancer center, but Inova also has a lot of other hospitals and cancer centers that have been treating cancer for a long time. And how has that come together in terms of having the bigger cancer center and the role of your other hospitals and their cancer programs?
I think the one thing that we tried to strive to was making sure to understand, and we're a 5-hospital health system spread across Northern Virginia. And even though our 2 furthest points might only be 40 miles from each other, if you've ever been to Northern Virginia, that could be 45 minutes or it could be 2.5 hours, depending upon traffic. And so we wanted to make sure that we kept a core value that cancer care needed to be close to home. And with that, we wanted to be able to provide cancer treatment at all 5 of our hospitals. That doesn't mean we provide all cancer treatment at all 5 of our hospitals. It just means that if we can coordinate the care through SHAR as an institute that works together and networks together, then we're able to provide care. So for example, if we have a lung patient that lives in the more western part of our catchment area, they might receive their surgery at Fairfax at our tertiary facility, but we don't want them to have to drive 45, 52 hours every single day for radiation treatment. We want them to be able to get radiation treatment at Loudoun. Or if they need chemo, we want them to be able to get chemo treatment close to home as well. But all of that care is coordinated, and all the planning of that care is coordinated through the system as a whole, so that your care treatment plans are not any different if you receive care in one location versus another. The other benefit of this is, and I'm sure you see this in your work, is cancer treatment providers. It's a resource, and you can't have a thoracic surgeon at every location. You can't have world-class hepatobiliary surgeons at all 5 hospitals, but you can still provide those services in one location and allow your whole community to benefit from that, and then provide at the community level more medical oncologists that will coordinate the care, more radiation oncologists, and making sure we provide support services at each of the locations as well.
That's great. Well, Susan, I want to thank you for sharing your perspective on Inova's journey. It's been many years in the making, and in the effort you all are making sure that everyone has access to state-of-the-art cancer care. Appreciate your time.
Thank you very much.